Bismillahirrahmanirrahim. Assalamu alaikum. This is Dr. Fawad Suleiman. I work as a psychiatrist in Department of Psychiatry. So I would be discussing this. The main aim of creating this video is to familiarize our doctors, to give them a kind of orientation so that they can enhance their knowledge, they can enhance their communication and other clinical skills. So the main aim of generating this video is that how we can counsel a patient's relative. If, for example, if a patient has presented with Alzheimer's disease and the relative is asking you to just tell them about the disease, right? So first of all, as in my previous sessions, I always tell you that introduce yourself in a very confident manner, right? Lean forward towards the family, and then you have to maintain a very good eye contact and open your body position, right? And just go according with the gestures, the facial expressions, whatever they have, right? And then, if, for example, if the cases of Alzheimer's disease, you can always ask them, what do they know about diagnosis? Does anyone tell them about the diagnosis before? Do they have some prior knowledge regarding Alzheimer's disease? This might happen that they have already, or they may have a huge existing knowledge before you tell them. So always remember one thing, just go according to the level of expectations what they have, right? For example, if a patient is just asking me, or if a caregiver is just asking me that tell me the clinical features, right, of any of the disease like multiple sclerosis or depression or whatever. So I just have to describe them the clinical features, not the whole disease process, right? So let's begin. First of all, clarify about the diagnosis after your introduction and the questions what kind of knowledge they have prior. So you can tell them that Alzheimer's disease is a kind of disease which is counted as a neurodegenerative disease. It affects mainly the memory, our daily functioning, right, and other areas of personality. So this is a bit about definition of Alzheimer's disease. And secondly, when we talk about statistics, you can tell that the studies indicate that the patients who have Alzheimer's disease, their relatives have 3 to 4% increased chances to develop Alzheimer's disease, right? And it has been shown that 1% of the Alzheimer's disease is being carried forward by the genetics, right? So that was the 1%. Now coming towards etiology, you can tell the caregiver that it has been observed or it has been indicated by the research studies, the patients who have already a history of head injury, or the patients with lower intellectual functioning or lower academic history, or prior history of depression, they are at increased chances to develop Alzheimer's disease. And other risk factors like patients who have Down syndrome, they are also at an increased risk, or there is also evidence of ApoE for lipoprotein, which is also contributory protein in the progression of Alzheimer's disease. For example, if a relative is asking you something very interesting about Alzheimer's disease, that what kind of precautionary measures we can apply for this particular patient, then you have to tell them about the ways, right? Prevention of injury, right? Enhancing intellectual functioning, involving someone in making decisions, right? And preventing depression. These are the key factors, which causes Alzheimer's disease. So we have to prevent these factors, and I have made already videos on these selected topics. So this was all about genetic counseling, what we can do in Alzheimer's disease. I thought to um, provide or forward this knowledge from my end to your end, so with the hope that we would be continuing the mutual process of learning. So thank you so much for your time.